Welcome back. We are answering your questions about the coronavirus with Chief Pharmacy Officer at Cone Health, Dr. Deanne Brooks, and Dr. Jay Ravishankar with Cone Health, Alamance Regional Medical Center, Infectious Diseases. All right, so doctors, let's go with this first question here. Dr. Ravishankar, since you're new to the Q&A, we're going to let you go first here. This person asks, my wife is allergic to the flu vaccine. Will she be able to take the COVID vaccine?
Okay. First of all, the specific allergy to flu, is it some sort of allergy secondary to some previously had problem like Guillain-Barré, or is it related to egg, or what exactly is the allergy? Because a lot of times, even with flu, people would be able to take the flu vaccine even if they're allergic to it. But the mechanism between flu and COVID-19, the Pfizer vaccine or the Moderna vaccine is going to be different. And I don't anticipate somebody allergic to flu having an allergy to this vaccine. But we need to know exactly what type of allergy was it. That's important to know.
All right, that is something that they should absolutely talk to their doctor about before they go and do that. All right, Dr. Brooks, how and where will the general public get the vaccine, and can we choose which vaccine we receive?
I think that the general public will be able to get the vaccine maybe by about April of 2021, and it all depends on how fast the manufacturers are able to make the vaccine. And in terms of where they would get it, it's possible that they could get it at their local pharmacy. It's also possible that they could get it within clinics that either Cone Health will provide or potentially the health department. We are focusing right now on vaccinating our employees, and we're already starting to create the plan for the next phase of distribution and administration of the vaccines. And so I would expect more information will come out on that. And It seems like there was a second part to that question, Tanya. Did I answer it all?
They asked, can they choose which vaccine they'll receive?
Yeah, so I think that may be a possibility. I know that we're going to have a way that we can sign up to receive the vaccine through the North Carolina Department of Health and Human Services. And I'm not sure if there will be something on there that marks which vaccine that you want to receive. They're both going to be very similar. We will be vaccinating our employees with both vaccines. Now, if you get the Pfizer vaccine for the first dose, both of them require 2 doses. The Pfizer vaccine requires the second dose in 21 days, and you have to get the Pfizer dose for the second dose. The Moderna vaccine, same thing. If you get the Moderna vaccine for the first dose, you have to get Moderna for the second dose, and that second dose is given in 28 days.
So there is time in between that. So this person is asking Dr. Ravishankar, the vaccine is in 2 shots. Are you done with it then? Or is it going to be like the flu shot where you have to be vaccinated every single year?
Right now, the anticipation is basically you will get 2 shots, and then we will track what the antibody levels are and what is it going to be doing over the period of months. And also we need to know the effectiveness of the vaccine, right? We know it's got an excellent efficacy, meaning compared to placebo in the clinical trial, it was 95% efficacy it had. It prevented coronavirus infections. But in the effectiveness, we'll only know once it is let loose in the community and all of us get it. The most important aspect of knowing the effectiveness of the vaccine is then the higher the percentage of folks are vaccinated, then we'll know it better. Because if you don't have, at least 70 to 80% of the population will have to be vaccinated. Because if you may have an excellent vaccine, the excellent efficacy, but if not all people, if not a substantial proportion of the people take the vaccine, they don't take the vaccine, then we are never going to know the effectiveness of the vaccine. And that's how we will know how long the antibodies last, because it looks like the coronavirus does not mutate as much as the serotypes. Currently there's only one serotype. So I guess it may be that we may not need it, but it's too soon to say about that right now.
And we continue to learn, it seems, every single day, something else that plays into all of these things, right? We're going to continue to take your questions. The number is at the bottom of the screen, 336-379-5775. We'll be right back.